Good afternoon. My name is Brandy L. Lane, and this afternoon I will be discussing my middle range theory with you. My middle range theory report is on the theory of maternal role stress, and the author is Eileen Gigliotti. Miss Eileen Gigliotti presently is a Deputy Executive Officer and Professor in the Department of Nursing at the College of Staten Island, the City University of New York, New York. She holds a Bachelor of Science degree in nursing from Hunter College, a Master's of Art in nursing from New York University, and a PhD in nursing from New York University also. Her primary teaching focuses on nursing theory for advanced practice nurses and measurement in nursing research. Her professional interests include women's health and the maternal role, social support measurement and interventions, measurement issues, and Newman Systems Model and nursing theory development. Eileen Gigliotti has been a Newman Systems Model trustee since 2002, and she is also chair of the Newman Systems Model Research Institute. Dr. Gigliotti developed the Perceived Multiple Role Stress Scale, and she has revised the NORBEC Social Support Questionnaire to make it a more valid measure of perceived effect, affirmation, and aid. The title of the theory is Women's Multiple Role Stress, Testing Newman's Flexible Line of Defense. The purpose of the study was to investigate psychological maternal and student role involvement and perceived social support and the resulting perception of multiple role stress in mothers attending college. Gigliotti's theory is classified as a middle range theory because it contains only two variables, making it narrow in scope and practice, and her theory is strongly supported by empirical data, making it useful in clinical practice. Theoretical sources. Eileen Gigliotti acknowledges that her theory of maternal role stress was derived from Newman's systems model and the work of role theorist Kahn. Newman's work is evident in Gigliotti's theory by the use of the lines of defense to illustrate her theory. Gigliotti decided not use of all five client variables with her theory because it would have resulted in severe multicollinearity. Instead, she uses social, cultural, and the psychological client system variables because they are more congruent with Kahn's conceptualization of personality characteristics and interpersonal relations. The influence of Kahn is evident in Gigliotti's theory because Gigliotti focuses on mothers that are occupants of two roles that pose both conflicting and ambiguous expectancies, and this is in direct correlation with Kahn. For the psychological variable in the flexible line of defense, Gigliotti used the maternal role involvement questionnaire and the student role involvement questionnaire. The sociocultural variable in the flexible line of defense was measured by the NORBEC Social Support Questionnaire. Lastly, the normal line of defense invasion was measured by Gigliotti's own perceived multiple role stress scale. Primary sources. Eileen Gigliotti has several published works that relate directly to her theory. She has Women's Multiple Role Stress, Testing Newman's Flexible Line of Defense, that was in 1999. She has Etiology of Maternal Student Role Stress, which was published in 2004. She has Improving External and Internal Validity of a Model of Midlife Women's Maternal Student Role Stress, published in 2007. Eileen Gigliotti also wrote and presented several Newman Systems model papers at various forums and conferences. Selected papers include Women's Multiple Role Stress, which was at an annual Women's Studies Dissertation Competition Award Ceremony in New York. That was in 1997. She also presented at a 6th Biannual International Newman System Model Symposium on the same topic. She also did correlates of maternal student role stress that was presented at the annual gathering of the CUNY Nurse Researchers in 2000. She also presented on the same topic at Mu Epsilon Chapter Sigma Theta Tau's Distinguished Writer and Research Forum in 2001. She also presented at the Staten Island Nursing Diagnosis Association Conference in 2002, again on alter role performance in nurses with multiple role stress. She also presented at the 14th Annual Scientific Sessions of the Eastern Nursing Research Society in 2002. The topic again was maternal student role stress during concurrent transitions. Major considerations of theory. The purpose of Gigliotti's study of maternal student role stress was to test an explanatory middle range theory of conditions under which multiple role stress develops in women who are mothers and who are returning to college. Conceptualization of nursing meta-paradigm, client and person. In this study, the client/person is the mother/student. The two key variables that are pertinent to this theory are psychological variables and sociocultural variables. The environment. Gigliotti focuses on external environmental stressors, which are both extrapersonal and interpersonal in nature. These stressors are usually outside of the client's control. Health. The goal for health is for the client to be in the best wellness state possible. If a positive balance exists among environmental stresses of being a mother and a student, and there is sufficient social support, then the flexible line of defense will expand and offer greater protection to the individual's normal line of defense. And the vice versa will occur if the patient does not have a good social support system. Nursing. The nurse's core goal is to ensure that the client is in optimal health. Although as nurse practitioners, we cannot control what a client is doing once they leave our care. However, it is up to us to offer patient teaching and education. We have to be there and let the patient see that we care about their well-being and offer sound advice. Practitioners sometimes have to take on the role of confidant in order to gain trust in a patient so that they will be willing to listen and actually take heed to our advice. If all else fails, as a last resort, medication may be needed to help the patient as well. Major concepts and definitions. The major central concept of this theory is that both the student and a mother creates change in maternal identity as women attempt to meet personal responsibilities in those with their children. It is because of these two separate roles that can sometimes cause role stress for women. Major assumptions. Gigliotti's theory is derived from Newman system theory. It is an open living system. The goal. The goal is to protect the client from interpersonal and extrapersonal environmental stressors. Only two variables exist, psychological and sociocultural. Both must work together in a harmonious fashion to combat any environmental stressors. There are 5 rings consisting of lines of defense and lines of resistance that surrounds the basic structure that attempts to protect the client from stressors. If a ring is penetrated, then the goal is for the nurse to do whatever is necessary to return the patient back to their wellness state. Theoretical assertions/propositions. Newman believed humans were open systems that are in constant interaction with environmental stressors. Every human is different and will react to stressors in different ways. According to Kahn, personality characteristics influence how sensitive individuals are to the environmental role stressor, and that interpersonal relationships influence their interpretation of the environmental role stressor. Summary of theory and goal of nursing. Gigliotti's maternal student role stress theory considers the individual as a whole. It is an open system that consists of 4 primary concepts: human beings, environment, health, and nursing. All components work in harmonious fashion together to reach a common goal. The common goal is optimal client wellness. Being a mother and a student puts the client at risk of facing interpersonal and extrapersonal environmental stressors. The normal line of defense exists to help the client deal with and over time cope with certain environmental stressors. In addition, the flexible line of defense consists of the outer layer of the ring and reacts to immediate threats to the system. As a last resort, the lines of resistance protect the client in the 5 client variables that are contained in the basic structure. Stressors are a part of life and can happen quite often. Having a good social support system in place acts as a buffer to protect the client from having their normal line of defense invaded. The schematic model. As you can see, it consists of circles, and at the center of the circle are women who are mothers and returning to college. Now, the stresses are only 2: psychological, which could be stress of juggling motherhood, work, and school, and sociocultural, which could be lack of support system. Pertaining to Gigliotti's model, all of her stressors only affect or penetrate the flexible line of defense, which is the outer ring. It's the normal line of defense that we want to protect. There are many things that can attempt to penetrate the normal line of defense, that's affecting the flexible lines of defense, which are illnesses, job stress, family needs, family conflict, finances, resources, child strain, inadequate sleep. Of course, there's always going to be a primary prevention. So, primary prevention could include we need to identify the stressors, we need to prioritize time, reduce distractions, talk with your boss if necessary, get adequate rest. Secondary prevention would include reconsider your wants versus your needs. Make sure adequate assistance is in place before making a hasty decision. Talk with your significant other. Take medication if needed. And the tertiary prevention, which is the last, offer supportive counseling, re-educate client, and provide referrals if necessary. Logical form. Gigliotti chose the Newman Systems model as a framework to base her theory on. But due to the complexity of the Newman Systems model, it was not possible to test the entire Newman System model according to Gigliotti. In addition, there's a significant flaw in the logic because Gigliotti was only able to use 2 variables instead of the usual 5. Gigliotti was only able to use psychological and sociocultural variables to test her theory. Use of all 5 variables would have resulted in severe multicollinearity. The psychological and sociocultural variables were the most congruent with Kahn, and that is why they were used. However, many argue that Newman's other system model concepts could have been used as personality characteristics as well. So there's definitely a flaw in logic. In addition, this study focused on older patients, 37 and older. So what about younger women? There were also no demographic variables given, such as work status, age, or number of children. Other student role conditions need to be considered as well: culture, race, ethnicity, marital status, and college major. Relationship to research, education, and practice. There is definitely room for nursing research because this is a topic that is prevalent now. More mothers are continuing to work and return to school. Because social support acts as a buffer, opportunities to develop new relationships with others who are returning to school should be afforded. Basic requirement courses could focus on returning women students, and some course hours should mesh with children's school schedules. As a nurse practitioner, we need to recognize when there is a patient caregiver need and act as a patient advocate and offer support. Implications for practice. This theory hits home for me and makes me aware of the subtle issues that I need to pay close attention to when I'm in direct contact with patients. Example: a 37-year-old mother of 2 young children, ages 18 months and 3 years old, is coming to my clinic for her annual checkup. The secretary notices that the patient, while waiting to be called to the back, is trying to feed her smallest child while also trying to read a nursing book. The patient appears stressed out, the baby begins crying, and the 3-year-old is running all around the waiting room. Other patients are becoming annoyed. The patient loses her composure and begins to yell at the 3-year-old, and the patient herself starts to cry. I am notified by the staff, and I call the patient to the back. I place the patient in our exam room that offers guided imagery, soft music, and a more natural feeling environment. I initially notice that the patient's blood pressure is elevated. I initiate deep breathing techniques with the patient. Then I offer a listening ear. That can go a very long way for patients. The patient begins to relax, and she tells me that she is stressed out because she has just started going back to school. She states that it is very hard juggling parental duties, work duties, and school constraints. Not only do I act as a confidant, but I also take the opportunity to educate my patient on time management skills, eating healthy, and getting adequate amounts of sleep. I know that as an FNP, my focus is on disease prevention activities and using patient education and counseling to help patients make lifestyle choices that will promote overall health. I even give the patient referrals on child care assistance programs that offers extended hours for working mothers if needed. Upon recheck, the patient's BP is within normal limits. The patient states that she feels much better but asks about anti-anxiety medication. I ask the patient to follow up with me in 1 month to monitor this patient's stress level. However, medication therapy will only be considered as a last resort. In summary, being a working mother and a student is definitely a daunting task. It is also a rewarding one. Sometimes as women mature, they seek to define themselves through a process known as spiraling. A woman's self-definition is of utmost importance to the woman. When a mature woman's self-definition is compromised, it can sometimes lead to a woman making irrational decisions. As the old saying goes, anything in life worth having will not necessarily come easy and without blood, sweat, and tears. The reward of doing what you love and reaching your goals while also having an adequate support system is immeasurable. Thank you so much, and I hope you enjoy my video. Again, thank you.